It is difficult to understand that experiences of mental health professionals in Ukraine, where war breaks, can be comparable to employees in the rural areas of New Southern Wales. Lock Point's Ukraine mental health professionals work with NSW colleagues on support strategies. Ukrainian mental health professionals are working with NSW colleagues on their support strategies. Visit Dubbo Hospital to get practical methods. Treat patients with less sources. They visited the Dubbo Hospital to take practical methods to treat patients with less sources. However, Kiev-based psychiatrist Viktoriia Kolokolova said that he learned a lot during a visit Dubbo and received strategies used to work with patients with limited access face-to-face treatment. It is very difficult to get experts in rural areas in Ukraine, he said. He continued how doctors Dubbo do their applications remotely, build these interdisciplinary work, how they build this good teamwork and manage the problems. Dr Kolokolova is part of Group 7. Ukrainian psychiatrists, psychologists visiting Australia from Ukrainian Catholic University Lviv, and a Kiev-centered mental health NGO Bezbarynist group on an educational scholarship through the Ministry Foreign Affairs. The group is in NSW service for the treatment rehabilitation of victims of torture and trauma in Sydney, but was hosted by Western NSW Local Health Zone to look at strategies related to less resources, clinical environments. Ukrainian psychiatrists and psychologists visit Nunyana in Dubbo, an administrative center for the mental health team of the region. Dr Kolokolova said that clinical approaches he saw in the mental health unit of Dubbo Hospital have inspired more than other urban-based services he has ever seen. We didn't even talk drugs, art, a lot safe areas, light. We talked how important it is to bring caregivers, children and families and engage them. I think it's a very strong discussion and understanding for my group. Warren Kealy-Bateman summarized the strategies and tools used in Dubbo's mental health social assistance. Dr Kolokolova said Russia's demand for mental health support in Ukraine as it continued for a second year of Russia's large-scale invasion. The war was marked with widespreading of civilian regions of Ukraine and approximately 27,000 civilians since February last year. Dr Kolokolova said that generation trauma was a concern about this conflict, that Ukraine was the first war of Ukraine. He said that the work of him and his peers were equal to intergeneration trauma of native patients. They respect this experience, respect history, and use art and resources recovery. Accept pharmaceutics. Accept pharmaceuticals. Dr Kolokolova said. Warren Kealy-Bateman shows the tools used to support patients with mental health. Practical tools are urgently necessary. Dubbo Hospital is in a local government zone of 55,000 people. But as the primary hospital center, it reaches arm.